shared something with us, in preparation here, and it was a Harvard Medical School study that indicated that Leap Rail reduces operational inaccuracies like surgical case duration by 70% compared to the other leading EMRs. And I kind of wanted to pose this to Sam and Carie and ask, I think there are probably some people out there that are listening and going, okay, well, I already have an EMR that's doing this for me, right? So why would I need Leap Rail? And I think you've already answered the question, just maybe not as direct, when you start talking about, leveraging a broader data set to refine some of the predictive analytics. But I also want to hear about some of the actioning that comes from that data, because I think that ties into what sort of why you would need Leap Rail, even if you already have an EMR stood up.
So Leap Rail is not just a one uh, uh, solution. It provides so many solutions. So if you have an EHR that does great, case duration accuracy, great, that's awesome. But there's so much more to it for us. Is the block utilization? How do you calculate that? We were able to create more blocks and increase our block utilization from what it used to be like in the 60 percentile up to the 80, 90 percentile, because we were able to go back and look and tell the doctors which days they are least used of the month. So we're like, can we take away this block and we have another surgeon that may use it. And we've been able to increase that block utilization, like I said, by at least 30, 40%. And that's huge. That's huge. And then when you look at case duration accuracy, we've been able to squeeze in more cases. If I know I can run a couple of extra or do a couple extra cases and go right up to the 3 o'clock, 3:30 margin, it's fantastic. And it does kind of result in that efficiency, but also better cost savings for the hospital or increase, revenue for the hospital. So, Carrie, I know you probably have a different look too.
No, it's a lot of the same. I will say that case duration accuracy without tools to help you is like a crapshoot. I know if that's okay to say or not.
I agree, 100%.
It's
a shot in the dark. I mean, you just don't know.
It is like the tools we have with our EMR. They're great. Like Shayan said earlier, they average based on 6 months if they've done 3 of that procedure. But when you use codified values and things like that, not everything fits in that CPT code. So they might schedule with this CPT code, but they've done 5 in the room. So then that average is knocked way out of proportion. And then when you're trying to argue with the surgeon that he can't do a laparoscopic case in 15 minutes, he needs 30 or 45, it's like breaking up with a boyfriend or telling him he's ugly. You really need the data behind it. I know, right? You have to have the data behind it to say, look, I really need you, to schedule more. This is, from a surgery scheduling perspective, schedule a little more accurately, not only for you, but the people behind you, because you don't want to know the day of that you're running till 7 or 8 o'clock at night for these patients that, if your guidelines suggest and you have to cancel someone, unfortunately, at the end of the day or something like that.
And I look at actually from the patient's family perspective. If you schedule a case in, like in our case in Cerner, and we say, oh, this is only an hour and a half, but Leap Rail tells you, no, this is more like a 3-hour case. We tell the patient's family, this is a 3-hour case, so then they don't get into a panic mode at the hour and a half mark, wondering, where's my loved one? What's going on with him? Why is it taking so long? So it does help in so many variables.
The surgery schedule impacts every aspect almost of everyone's day. So I manage surgery scheduling, so I can really ruin it back here. I can ruin the circulator's day. I can ruin the tech's day. I can ruin I can ruin the anesthesiologist's day, the surgeon's day, the patient's day, and the floor. I mean, we affect everyone with that case duration accuracy. I mean, it's by far one of the most important things we can do well.